my top 5 reasons you really, really should celebrate Obamacare. I think there's going to be a lot of statistics and facts and figures that are thrown at you guys, but I want to kind of bring it home to these 5 points that I thought are possibly going to get lost in the discussion. I don't want you guys to miss it. So, starting out with number 5, one of the big accomplishments of the Affordable Care Act is that caring for your health won't cost you your wealth. For the first time in 50 years, people are not double-checking their pocketbook before they decide to go to the doctor. According to the Commonwealth Fund, back in 2012, there were 80 million working-age adults who reported at least one cost-related problem accessing needed health care. And last year, that number was 66 million. Still a lot of people, but to see that big of a reduction from 80 million to 66 million, that's really thanks to the Affordable Care Act making sure that the money that goes into the healthcare system is actually going towards people's healthcare. So that means 14 million fewer people were delaying their healthcare because they were worried about the cost of that care. So, this is huge for family economies across the country. And, the fact that we're having fewer problems paying our medical bills is a major accomplishment of the Affordable Care Act, and it's one worth celebrating. So that's my number 5. Number 4, is really all about women's health. Okay, so the reason why this is a big accomplishment is that plans are no longer allowed to use gender when they determine rates, meaning that women are no longer paying more for their health insurance just because they're women. There's a full range of preventive health services that are being covered, and these are saving lives. They're strengthening the health of millions of Americans. And these preventive services, they include prenatal care, breast cancer and cervical cancer screening, genetic testing and counseling for women who are at high risk for breast cancer, contraceptive counseling services and supplies, including prescriptions for FDA-approved contraceptives, breastfeeding counseling and support services, including breast pump rental, and intimate partner violence screening and counseling. I want to go on a small tangent here. Some people, like Charles Krauthammer on Fox Noise and a whole lot of others, they're saying things like, oh, they don't see the point of having to pay full-price health insurance when they don't need things like lactation consulting. So why should they pay for it? Enough with the misogyny, okay? Honestly, when it comes to health insurance, Medicare, Medicaid, you name it, these things depend on risk pooling. So what that means is that we all have to put in a little bit into the pot so that none of us are financially ruined because of an illness. So Charles Krauthammer on Fox Noise, that means that there are lesbians having to pay for your erectile dysfunction medication. They have to pay for your prostate cancer screening. And may I remind you that you just turned 65 this past week, so that means that my tax dollars are covering your Medicare, whether I like you or not. And this is the thing what it means to be in our healthcare system with risk pooling. If anything, think of it as united we stand in a living day-to-day form. This is what we got to do for each other, and quite frankly, I'm proud of the Affordable Care Act making these preventive healthcare services for women affordable so that our sisters can get the care that they need and not have to worry about the cost. Okay, so that was number 4. Number 3, this one's actually kind of impressive. Number 3 is that people living in Republican counties are benefiting from Obamacare, and sometimes they are benefiting more than people living in Democrat counties. Now, stick with me on this one. The New York Times looked at data this past fall about who was getting insured and who was not, where they lived, all that kind of stuff. Now, before the Affordable Care Act, 18.5% of people living in Republican counties were uninsured. Now, 13.1% of people are living in Republican counties without health insurance, and that number keeps on dropping. That's not even considering the insured during the more recent open enrollment period. So there's a pretty good chance that that number is going to drop and drop and drop. But we're talking about 18.5% of people without health insurance in Republican counties before Obamacare, and now we've got 13.1%. So that's a pretty significant drop, and it is thanks to the Affordable Care Act. And, it actually kind of points out why it's so ugly and stupid to play politics when it comes to this law. The law is helping people regardless of their political ideology, and it would work even better if we agreed to just put ideology aside and do what the law was intended to do, and that is make the human right of seeing a doctor when you need one possible for every American. All right, so, that little like political, paradox or like anomaly, I guess you could call it, is my number 3. My number 2 is a shout out to Medicaid. Medicaid is doing wonders under the Affordable Care Act, and you're probably not going to hear enough about Medicaid when it comes time to celebrate Obamacare. So let me lay it out for you. Since those exchanges opened up back in October of 2013, those exchanges actually also directed people whose incomes qualified them under the Medicaid expansion to get enrolled in Medicaid. So now, here we are, a couple of years later, and we have 7,857,000 Americans. That's 7,857,000 Americans who are enrolled in Medicaid in those states that chose to expand and allow people who are now making 138% of the federal poverty level, or about $33,000 for a family of 4. Those families are now getting coverage because of Medicaid expansion. Medicaid is doing a fantastic job in the Affordable Care Act, and it really ought to be celebrated more and more and more. If you look at the people in Medicaid, they will tell you that, when they actually survey folks, they are finding that people are happy with the care that they're getting, that they are able to find a usual source of care, that they're not having the trouble finding the specialists that they thought that they were going to have before, and they are using the emergency room less and less. So Medicaid is actually doing wonders for the Affordable Care Act. It does not deserve the treatment that it's getting in the Republican budget right now, and I really hope you guys will keep pushing for Medicaid as it currently stands in a lot of states. I hope we keep building on it, and I hope those states that are not expanding Medicaid will see the light and offer health justice to millions of Americans. Okay, and that brings us to my number 1 reason to celebrate Obamacare that maybe you're not hearing enough about. All right, and here it is. My reason number 1 is that the Affordable Care Act is a civil rights victory. And honestly, this is the part of the Affordable Care Act that I love the very most. And that really is that prior to the Affordable Care Act, African Americans and Latino Americans made up a disproportionate number of the uninsured, made up a disproportionate number of the people without health insurance. They were more likely to not have health insurance because they worked at jobs where their employer was not sponsoring coverage. And when you when you look at what the Affordable Care Act has been able to offer communities of color, for African Americans, the uninsured rate fell from 22.4% to 13.2%. That's a 9-point drop in the uninsurance rate for African Americans. For Latino Americans, that number did even better. It went from 41.8% to 29.5%. We're talking about, an incredible amount of healthcare coverage that is happening because of the Affordable Care Act, and it's largely because of Medicaid expansion in those states that I was talking to you about. But I can tell you right now that the job is not over. We've got 4 million of our fellow Americans who are stuck in that coverage gap, meaning that their incomes are too high to qualify for their state's Medicaid, but they're not earning enough to shop in the federal exchanges. So there's 4 million of Americans who are stuck in that coverage gap who don't need to be. If Medicaid was expanded, these 4 million would actually have their health insurance, and those 4 million are actually still showing us what a civil rights injustice is being done, because when you look at those 4 million, 26% of them are African American and 24% of them are Latino. So we are actually finding that these disparities in care can be wiped out if we expand Medicaid. And so, as much as I'm pointing out these as causes to celebrate, I hope that my top 5 is giving you guys reasons to actually, stay active, stay on top of your lawmakers. Let's keep building this healthcare system for all of us, because honestly, we can do better. We must do better. We're Americans and we need to act like it.